And early this week, nurses and midwives in Nigeria's capital, Abuja, expressed worry over the modalities and procedures set by the nation's Nurses and Midwifery Council for the verification of nurses in the country. Now, this was made known in Abuja as they took to the streets of the capital, saying several stringent conditions have been put in place which are affecting their practice and stalling their professional development.
Now, if you remember, in March, Nigerian nurses protested in similar fashion in Abuja and in Lagos against the new rules to prevent them from working abroad for 2 years after completing their training. Now, a rule imposed by the authorities trying to stop the exodus of medical talents being mirrored against the continent. Now, our correspondent, Amadin Uyi, was on ground for the protests, and he filed this report. And when we get back, we'll be joining him and talking to him. Oh, let's say hi to him already. Amadin, good morning. Good to have you here.
Good morning, breakfast expert team.
Thank you very much.
Good morning, Amadin. And thank you so much for coming on. We're going to take a look at your package, and then we'll come back to have this conversation with you.
The protest commenced from the Federal Secretariat in Abuja. The protesters, aggrieved nurses and midwives, said they want the federal government to intervene in the crisis affecting the Nurses and Midwifery Council of Nigeria over stringent conditions set for the re-verification of nurses.
The verification is not them ascertaining if you're working well. Verification, they are just asking you, are these people registered? Have they written the Nursing and Midwifery Council exam and have they passed? Do they have a license to practice? If yes, is their name on your portal? That is just the verification, and that is what they are asking for. Yet they said we need all these things, and that is what we are saying no to. These things weren't there, so it just came up all of a sudden.
They say the conditions are now affecting their professional development.
Now nobody is being verified, and most of our nurses have missed out on opportunities that they've had. Some that want to continue their education, now they've gotten a letter from where they got admission that they cannot continue with them, which is why we are crying out again, because we are calling on our fathers and mothers. We know they have children that are nurses also, that they should come to our aid and talk to Nursing and Midwifery Council, that they should reopen the portal and verify nurses the same way it used to be, and not with the new guidelines.
A member of the House Committee on Health Institutions, who was out to receive the aggrieved nurses, assured that their grievances will be looked into.
Once you put down your request again, we'll call the necessary authority and look into this matter. And I'm assuring you, we will not wait. I'm assuring you by tomorrow, we will put a call to all the relevant authority and sit with them and see how to address your situation. We are also going to look at it, and even whatever the government needs to put in place must be according to the law. Yeah, nobody is going to be harassed, nobody is going to be bullied, nobody is going to be intimidated.
The nurses are also calling for the employment of more hands into the nation's health sector, saying the lack of hands has been affecting their performance. In Abuja for News Central, I am Amadin Uyi.
And that package that was created was done by Amadin Uyi, filed it over the week just following the protests from the nurses and midwives, and just to understand what their grievances were. Now we're being joined by Amadin Uyi, our Abuja Bureau Chief. Amadin, very good morning to you again, and thank you so much for coming on.
Good morning.
Good morning. Give us an idea of the import of the claims by the protesting, or rather the importance of the claims by the protesting nurses and midwives at the protest.
Okay, first of all, you have to have a proper context of, proper idea of the situation with nurses. We, just like you said, the Japa syndrome, which has affected a lot of professions in Nigeria, where the nursing profession is one which has, in the last few years, it has become a sort of like high-profile profession outside the shores of Nigeria, because we hear that Nigerian nurses are in high demand in Asia and Europe. and even in the US. So we've had this exodus of nurses out of the country in search of greener pastures. Now, what the Nurses and Midwifery Council now decided to do is that, considering the fact that they now understand that it is becoming a problem for the nation's health sector, where we are losing professionals, brain drain, and others. So they have now set up certain guidelines in place to practice as a nurse and ensure that once you graduate from university or nursing school, Nigeria can retain you for like 2 years. So they've come up with this idea, first of all, to re-verify existing nurses, and to re-verify those nurses, they have to come up with certain documentation. So, but what the practicing nurses are saying is that, see, the exodus problem is not just caused by us. It's a problem that has to do with the economy, because nobody who gets an opportunity to work outside this country and you are being paid 10 times what you earn per month, nobody will want to pass on that kind of opportunity. So they are saying that these guidelines set up by the Nurses and Midwifery Council, it's extreme, because beyond nurses migrating for greener pastures, some of them intend to also upgrade their career and go to school, get more qualifications. And these guidelines are also affecting them. They also say that beyond the exodus problem, there are other problems affecting the nursing profession in Nigeria. First of all, they have inadequate hands. It was from the protest I heard that nurses also have specializations. They said they have inadequate hands, that people think once you're a nurse, you can work in every department of the hospital. No, they have orthopedic nurses, they have different kinds of nurses, that they are inadequate hands, that government, first of all, needs to employ more nurses in the hospitals. Then there's a problem of wage review. They say they are being far underpaid, that they want government to take a look at their wages, considering the fact that they hardly go on strike. Most of the time, medical doctors go on strike. They remain in the hospitals working, and then the perception is like nurses are not important in the hospitals. Then the ultimate problem that has to do with re-verification, that those guidelines by the Nurses and Midwifery Council of Nigeria has to be reviewed, because it is affecting them, it is affecting their career progression, it is affecting their career development. So they took their protest to the National Assembly, hoping that the lawmakers who oversight the executive agencies can intervene and call for a resign of some of these decisions that have been made in recent times.
So, Amadin, at the protest, we saw an authority there, but were there any concrete resolutions that were reached at the protest regarding the requests by the parties that were protesting? Amadin, did you get that?
Amadin, can you hear us?
I didn't get that. Please come again.
Okay, my question was if there was any concrete resolution that was met for the protesting parties. Did they reach any conclusion saying, yes, definitely we will do this or that, and at what time?
Okay, fortunately for them, the chairman of the Health Services Committee was driving into the National Assembly, and he saw the protest and identified that they were nurses. So he had to step down from his car. He called a fellow lawmaker and assured them. He said some of these decisions will be, some of these concerns will be looked into. He assured them that the parties involved, they will have to call the parties involved to be able to also hear from them why these decisions are made, and also to ask them if they understand that these decisions are also have sort of like a ripple effect also affecting other things that have to do with the nurses' career progression, their development, and the rest. So when the nurses submitted the letter to him, he assured them that from the very next day, they will call for a meeting, that the committee was also concerned about the Japa syndrome and the brain drain and the loss of nurses. But the committee still believes that in as much as that needs to be addressed, that they have to understand that the welfare of the nurses are important. So that was the resolution that was what they agreed on at the protest, collected their details, saying that in the next few weeks, a public hearing will be held so that the nurses and all aggrieved parties will have an opportunity to present their concerns and grievances.
Amadin, many thanks for that. You just talked about how the nurses on ground there, we understood that, for the committee to look into the matter, it would take a bit of time. But I mean, the chairman who was there receiving their letter containing the demands, when he received them and assured them that the matters would be looked into, what was the general mood like with all of the nurses on ground there? Did they take that information positively, or was it just taken with a pinch of salt?
I think they did, because first of all, the attitude of the lawmaker was impressive. He had not gotten into the National Assembly. He was actually driving past. And when he saw that the process was by nurses, he alighted from his car and walked up to them. So that alone first gave the protesting nurses the assurance that his concerns for them are genuine. And when he also informed them that that there will be a public hearing to look into these issues, you could feel that satisfaction, that contentment. To get the attention of lawmakers. And now you got a lawmaker who is in charge of that committee that is meant to look into the concerns, coming himself. Unlike what used to be in the past, they will send one or two National Assembly aides because they do not want to engage with these protesters. So the general mood was that of excitement and contentment. And the nurses said they were hoping to get that feedback from the lawmakers on
Amadin, many thanks so much for just doing this and just going in details and just helping us to understand what's behind. But were you able to speak to any of the nurses there? What is going to happen tomorrow? Because we understand that tomorrow is the D-Day for the International Nursing Day worldwide, and I do understand that I'm guessing the nurses there will be doing something special. Are we going to see a larger, maybe a walk, so to speak, to commemorate the day?
We've not confirmed the walk, but I know that in the last few days after the protest, there's been several programs by nurses in Abuja in commemoration of the International Nurses Day. And everybody is excited. Everybody has been engaged in one activity or the other. So for us, our fingers are crossed, and we'll be looking forward to whatever comes from them.
All righty then. Thank you very much, Amadin Uyi, our Abuja Bureau Chief. Thank you very much for joining us and giving us the details and behind the scenes for that report from earlier this week.
Thank you, Breakfast Extra. Thank you.